So menopause, this is a permanent cessation of reproductive fertility, occurring sometimes before the end of the natural lifespan. The term menopause describes the reproductive change in human females, where the end of fertility is traditionally indicated by the permanent stopping of monthly menstruation or menses. Menopause begins after the last episode of menstrual bleeding. It is recognized 6 to 12 months of amenorrhea, occurring between the ages of 41 to 52 years. During this transition, the ovaries start producing lower levels of natural sex hormones. Those are the estrogen and progesterone. So, age at onset of menopause may be influenced. So, the age of onset of menopause may be influenced by nutrition, nutritional factors, cultural factors, or genetic factors. The exact physiological mechanisms initiating its onset are not known. Onset occurs when ovarian function ceases, resulting in estrogen levels diminishing to the point the menstruation stops. So generally, ovulation ceases prior to menopause. In the Western world, the most typical age range for menopause is between the ages of 40 and 60, and the average age for last period is 51 years. In developing countries, the median age of natural menopause is considerably earlier at 44 years. Functions of female sex hormones. The estrogen promotes the normal development of a woman's breast and uterus and controls the cycle of ovulation and affects many aspects of a woman's physical and emotional health. Progesterone controls menstruation and prepares the lining of the uterus to receive the fertilized egg. There are types of menopause. There is early menopause. This is defined as having the final period between the ages of 40 to 45. Late menopause. This is where a woman's last period occurs between the ages of 55 to 60. Then we also have premature menopause or premature ovarian failure or induced menopause. This is a situation where a woman's ovaries stop working at a very early age. Okay, they stop working at a very early age, ranging anywhere from the age of puberty to age of 40. Premature menopause is not considered to be due to normal effects of aging. Some unknown causes of premature menopause include surgical removal of both ovaries because of an abnormality in their structure and function before the age of natural menopause. Hysterectomy is another cause. So hysterectomy is induced menopause, which occurs if the nerves and blood supply are damaged. Autoimmune disorder, thyroid disease, diabetes mellitus, chemotherapy, and radiotherapy. These are also some known causes of premature menopause. Okay. The factors that influence the age of menopause include cigarette smoking. So in cigarette smoking, there is experience of menopause, where there is this woman is going to experience menopause 1.5 years earlier. Okay, then nutritional status. So women with poor nutritional status experience early menopause. Body fat. Estrogen production is influenced by body fat. Thin women experience menopause earlier than obese women. Hereditary. Some studies have indicated that mothers and daughters tend to have menopause at the same age. High altitude. Women living in high altitude are more likely to experience early menopause. Then we also have the physiology of menopause. Okay, so the transition of menopause is usually gradual. It may take about 6 to 8 years. This transition period is known as climacteric, during which the activities of the gonads slow down and ultimately cease completely, resulting in physical and psychological changes. This transition of menopause is divided, or the climacteric period is divided into 3 phases, known as the premenopause, menopausal, and the postmenopausal phases. As the ovaries atrophy, the estrogen levels fluctuate, resulting in changes in the menstrual cycle. The menses become irregular, different in character, and duration of the flow decreases. Some of the physical symptoms that in menopause, you are going to notice that ovulation ceases and estrogen levels drop, causing changes in estrogen-dependent tissues. Low estrogen levels affect the stability between the hypothalamus and the autonomic nervous system. This triggers what is called hot flashes, which is experienced by 85% of menopausal women. Hot flashes, this is the most common symptom experienced by menopausal women. A hot flash usually lasts about 5 minutes, but some women experience a hot flash every 15 minutes. They get worse in the late afternoon when it is hot, after hot drinks, after hot or spicy foods, and when stressed. They decrease after about 2 years. Flashes also coincide with surges of luteinizing hormone, resulting in reddening of the skin of the face, the neck, and the chest, along with a feeling of intense heat. Increased sweating may also occur, especially at night. Breast tissue atrophies and the vaginal lining becomes thin. There is decreased vaginal mucus production, dryness of the vaginal mucous membrane, leading to burning and itching, as well as dyspareunia. The vaginal pH level increases as the Dowdline bacilli decrease. Others may experience decrease in libido. Osteoporosis may also occur. There is a loss of quantity of bone tissue, leading to increased fragility and postural changes. The women are prone to fractures. Low levels of estrogen also affect the cardiovascular system, leading to coronary heart diseases. Other symptoms include fatigue, joint pains, dizziness, and heart palpitations. The physiological symptoms that may be noticed includes insomnia, nervousness, irritability, memory loss, depression, and mood changes. The nursing care for menopausal women that we can look at is that you can help women to accept menopause as a natural and non-pathological process. You should advise women on measures to seize the transition. Okay, hot flashes. These hot flashes, it is a good idea to dress in layers, so you can take off or put on clothing as needed. Advise the client to sit in front of a fan at home or at the office, or she may have to sit outside the house where there is a free flow of air. She should also avoid hot drinks and spicy foods and drink cold water. Although hot flashes can occur during exercises, regular exercises, regular exercises can help beat flashes and relieve insomnia. Low dosage of certain antidepressants can also help relieve flashes. Then when it comes to night sweats, the way you can help the patient is that you can advise them to wear light pajamas, have a brief shower when they wake up drenched. Then on sleep disturbance, when they have sleep disturbance, half an hour's exercise every day will help insomnia, as long as the patient does not exercise late in the afternoon or at night. Then they should avoid smoking, heavy meals, coffee and alcohol after 16 hours, and they should not work late. So make sure that you advise the patients to be in a room which is dark and cool. Then when it comes to mood swings, they can be a problem, particularly for women with a history of premenstrual syndrome or postnatal depression. So hormonotherapy can help mood swings, but you should know that mood swings are not the same as the depression. So do not treat mood swings as the depression. Okay. Then when there is dryness, lubrication with water, soluble jelly or oils, and application of estrogen creams can compensate for vaginal dryness and tightness, making intercourse easier. Abstinence may lead to severe shrinkage of the vagina and introitus. So women should be advised that continued sexual activity will assist in maintaining the sexual functioning of the vagina. When a patient is experiencing forgetfulness, the way you can help them is that this client should be assured that she is not alone if she is feeling absent-minded. These two will pass. She should make sure she gets enough sleep and exercise every day. Relaxation techniques, especially slow rhythmic breathing and avoidance of stress, have shown to increase vasomotor control, alleviating the embarrassment and discomfort the sensation brings or involves. Also, they should have a healthy diet to keep the bones strong, maintaining a healthy weight, get regular exercises, and also not to smoke. That's all about menopause. If you have any questions, you should comment in the comment section, subscribe and like the video. See you in the next session.